All right, and for the end of this segment, we're going to be focusing on the lower back tightness and pain, and how to get rid of it. So first, we need to know where it comes from. Mostly all the lower back pain that I've encountered has been due to hip weakness and overactive quads. So let me explain why that is. So in the hip video that I just did, I talked about a particular muscle called the psoas major. Now, if you don't remember, the psoas connects to the inside of your femur, travels all the way to the inside of your hip, and it connects to the sides of your lower back. And so if you don't have any connection or strength with that muscle, what tends to happen is that that muscle tends to become overactive, either in a shortened or in a lengthened position that just pulls the heck out of your lower back. And the way to fix that is by doing the same exercise we did for the quad dysfunction and for the hip dysfunction, which is the glute bridge. And the reason behind that is because the glutes are mainly responsible for stabilizing your hip and for extending of the femur, which if the glutes aren't functioning properly to do that, the hip starts coming out of place, and then you start using the quads to very incorrectly move your femur. And as you can kind of see by the exaggeration of my joints, looks like my lower back is pretty tight. So you'll find that once you do the corrective exercise, once you do the self-myofascial release for the quads and the piriformis, that everything's going to feel a little bit less tight around this area. And so the final piece that is special to the lower back is going to be the connection of your hips to your rib cage and to your chest, which the main muscles that are responsible for that is going to be your core. So what we're going to do is we're going to go back to the glute bridge exercise, connect to the glutes and the hamstrings like we did before, and now I want you to focus on almost doing an ab crunch as you're doing this exercise. And once you get up here, this is probably going to feel like the hardest glute bridge that you've ever done in your life. And that's exactly what we want. We're using the appropriate muscles that have been asleep and have been bullied for quite a while, which have been causing this lower back pain that you've been feeling. Okay. Another exercise that we can do is the physical therapist exercise called the dead bug. So in this case, they give you a simple instruction of either just moving your legs individually or moving the opposite hand. We're going to just focus on the lower body. So here, once again, we're going to focus on the glutes to extend the leg, but we're also going to focus on having the glutes stabilize the hip and the abs straighten the lower back while you extend that leg as far as you can. So, although the goal of this exercise is to completely extend the leg and have the heel barely touch the ground, you're going to find that you're only going to be able to go so far until your lower back wants to come off the floor. All right, so that is the beginning of the dysfunction. So as soon as you feel that lower back come off the floor, that is as far as you go. We're going to stop and we're going to focus on recalibrating the tightness of our glutes and our abs to be able to keep everything nice and pushed down as we extend the leg as far as we can. And although this exercise looks easy, you're going to find that if you're not used to using these muscles and you do have lower back pain, it's going to be very difficult because you are not used to using those muscles. So, if you do a few sets of those correctly, I guarantee that you're going to feel a lot better in that lower back.